Welcome to the very first episode of the official podcast of the Ministry of Health and Family Welfare's Tobacco Free Youth Campaign 2.0. I'm thrilled to kickstart this very important conversation that is aimed at raising awareness, inspiring change, and empowering young people to live healthier, smoke-free lives. To set the tone, we are honored to have a very special guest on the show today. He's one of the most renowned names in the medical fraternity, and with his experience and leadership in healthcare, he's going to tell us the real impact of tobacco use and what we can do to protect ourselves from its harmful effects. This is a conversation you don't want to miss. Please help me welcome the Director of All India Institute of Medical Sciences, New Delhi, Dr. M. Srinivas. Welcome to the show, sir.
Thank you.
One of the things I wanted to ask you is, what is the most common impact you see of tobacco use in your experience?
See, at All India Institute of Medical Sciences, we cater to a large number of population. In a day we get almost 15,000 patients per day, and a significant number, which is increasing over a period of time, is the addictions to the various substances. And the tobacco is definitely is the most important thing for us, because the effects of the tobacco are on every part of the body. You name it, whether it is lung, whether it is the heart, whether it is the gastrointestinal tract, whether it is the endocrine systems, whether it is the brain, and to the fetus also, from the mother to the fetus. Every organ is affected by the tobacco. It's not only the smoke, but also the nicotine, which is responsible for that. For example, the most important thing what we see is the lung issues, the lung diseases like obstructive pulmonary diseases, COPD, what we say. And at the heart, that tobacco is responsible for the ischemic heart diseases, the so-called heart attacks which we get, coronary artery disease, because there's a spasm and the blood supply gets reduced. Then you have the most important thing what we see in the various advertisements, tobacco causes cancers. If you ask me, the tobacco causes the cancer everywhere. Most important what we see is the oral and the airways, the laryngeal and the gastrointestinal tract, the lung cancers, and then beyond that, even to the level of the kidney, urinary bladder, all those areas, this tobacco usage is responsible for the cancers. And the peripheral vascular diseases, because the blood supply becomes less to the limbs, and the limbs will get the ischemia. And it is also interesting to tell the people that it is not that the person is getting affected, and it goes beyond to the reproductive system, male infertility, female infertility, and if the mothers are smoking, and then there is an issues with respect to the fetus also, because the fetal brain development is also affected by the tobacco usage by the mothers. And in the brain, a lot of cognitive issues are there, and if you look into the people who have early degenerative diseases, Alzheimer's, early Alzheimer's sort of diseases, the cognition is reduced by that. So basically it encompasses all the organs of the body, if you look into that, and it is not just the cancer. And what we are not seeing is that other diseases, of the lungs and the heart.
Which is actually my big takeaway from our conversation, कि मतलब वो खाली कैंसर की फ़ोटो देख के हम बोलते हैं कि हाँ नहीं मुझे नहीं होगा, या आप देखते नहीं हो, या उसको नज़रअंदाज कर देते हो. बट व्हाट यू आर सेइंग इज़ कि वो तो सिर्फ एक पार्ट है. देयर इज़ अ होल other host of issues, including things like degenerative diseases like Alzheimer's that get impacted with tobacco use.
Yes, you're absolutely right. जो दिखाया जाता है कैंसर का है, वो तो बहुत भयानक होता है, इसीलिए it is there. And it is very difficult to depict everything.
Yeah.
And how do you depict an ischemic heart disease, obstructive pulmonary diseases, infertility? Then you will have the entire spectrum of the medical encyclopedia there. The tobacco causes everything. And the most important thing is, of course, the cancer, and that's why it is depicted on the products which we are using it. And on that, it is very clear that it produces cancer. There is no doubt about it. But there are other diseases also, as I said.
So have you seen any change in trends in the last, let's say, decade or so of dealing with patients? Has there been any shift or change that you've noticed in tobacco use?
You see, tobacco as such, the usage was less before, and it was in a different forms. The people have various methods of taking it, which would be just a smoking of a cigarette. in the form of a BD or something like that. And then the direct tobacco usage is also there. They keep it in the oral cavity, and then the oral cancers are there which are being produced by the tobacco usage.
Which is like gutka.
Gutka, pan masala, all those things. There were in fact tobacco laced toothpastes and everything. Those days I have seen them. I don't know now, they may not be much there. But over a period of time, you see that there's a shift from the smoking to the other methods of say nicotine. Nicotine is as poisonous as smoking. It has a chemical agent which has its own issues. And then
actually, most people don't understand the difference between nicotine and smoking. Like for most smokers, I suspect it's one and the same thing.
Yes. See, unfortunately, we have to understand this. The nicotine is the most notorious chemical, and it does reduce the blood supply to the heart. It produces and it increases the blood pressure, hypertension. So on one side you have reduced blood supply, and other side you have hypertension, which is there. And then when you look into the other organs, any organ for that matter, being a pediatric surgeon, I always tell to the mothers that the nicotine definitely has an issues on the fetal brain, the development of the fetal organs. And the fetal brain development is something which is again we need to tell to the people.
A lot of people say nicotine patches or nicotine chewing gum. You're saying they also have a downside.
Yes, unfortunately very few people take the help of the doctors to quit the smoking. When they come to the doctors, some doctors, and not all of them, they might prescribe replacement in the form of nicotine, but that is a very controlled fashion. It's a therapeutic method wherein they will be given with a lower doses and over a period of time under supervision with the various techniques. But of course there are other drugs, there's the drugs called clonidine and other drugs which are far better than the nicotine. But the people think that the nicotine patch is an alternative for the smoking, which is not right, because nicotine is also a chemical, and it is also a chemical which has deleterious effects on the many parts of the body. And in fact the smoking causes the effects through the nicotine, apart from the smoke. The chemical agent which is there in the tobacco is the nicotine again.
So what about these new trends of vaping and e-cigarettes? I know a lot of people think that they're better than smoking.
See, there's nothing better. You cannot say that the smoking is, the nicotine is better than the smoking, or the newer vapors are better than this thing. This is all driven by the marketing forces. If somebody says that I want to quit the smoking, if he goes to the doctor, probably he will give support first, and then give something which is non-nicotine. And if he thinks that the person is so addicted to the nicotine, then there will be sort of de-addiction to the nicotine. That's what that will be planned. It is not given as a choice that the nicotine is given for de-addiction. If it is not possible, the doctor, the psychiatrist, or the de-addiction center doctor, whoever is there, he will see to it that what is the best modality of the treatment for the patient to have.
What is the impact that you're seeing on very young people? Because there are also reports now of kids in school who are vaping and thinking it's not as bad, or it's easier.
It's definitely a wrong statement. It is definitely as bad as the smoking. And in fact, you see what is vaping. Vaping is, in addition to the nicotine, which is giving the so-called kick and the thrill, because ultimately it becomes an addiction, and then dopamine is released, that the children get this pleasure of that, and somebody says that. It's all conditioning. Somebody says that it gives the thrill, you feel the thrill, And in addition to that, it has chemicals, those volatile chemicals which are definitely injurious to the lungs and the airways. And there are cases, there is a direct lung injury, and then there are serious complications out of it,
Any sort of suggestion that you have in terms of what could be a good way to do cessation of tobacco use and stop smoking? Because I think most people think कि बस एक दिन decide कर लिया और हम छोड़ देंगे. And for some people maybe that works, but for most maybe it doesn't.
See, the first thing is that we have to understand first, smoking is injurious to health. That we have to understand. Having known that, now that commitment has to come that we should quit the smoking. And if we are not in a position to quit on our own, it is better that we go to the hospital, the doctor. There are people who are specialized in this area, in the departments and the de-addiction centers, wherein they will help the people, because what is happening when, as an individual, as a patient, if I decide to quit, I may not be in a position to quit. let the doctor decide. Doctor will assess there, and the doctors in the de-addiction centers, and then we need to tell the people, even if we quit at this moment of time, there are benefits of that. That is something which is very important, because many people think that I've been smoking for ages, probably the damage is done, or the damage is not done, and I'm able to withstand. Cancer is not a one-day job. There's a gradual build-up of a cell which is becoming abnormal and then eventually becoming cancerous cell.
So one of the things I wanted to ask you is what role can healthcare providers play, because chemical drug de-addiction centers are common, people know about them, alcohol sort of de-addiction centers are common. A lot of people don't realize कि smoking या tobacco use छोड़ने के लिए भी आपके पास मदद available है.
Yes, in fact there are tobacco cessation clinics in most hospitals, and it is not necessary that you have to go to a de-addiction center or tobacco cessation clinics. Anybody, whether it is in a setting of a smaller hospital or a clinic, or the bigger hospitals like this where there are dedicated de-addiction centers and the tobacco cessation clinics, the doctor generally speaks to the patient first and gives that strength that you should have this knowledge of it, and it is better that we quit the smoking or the whatever the substance abuse we have, and then give a hand holding. Then we will say that if you are not able to take care of the so-called withdrawal symptoms, there are methods to take care of them for a short period of time in a very controlled fashion, and it is sort of therapy, de-addiction and a therapy which is possible. And the most important thing is the doctor always talks about in a holistic way, and it needs to be reinforced. As a doctor, I think that the most important thing is that I should not be waiting for an opportunity to tell everybody, everybody whoever comes to me, if a pregnant mother comes to me, I can just reinforce, the smoking is not good for you and to your baby, the fetus also. And whoever is seeing the patients, it takes few seconds, a few minutes to say that, smoking is injurious to health, it produces cancer, it produces injury to the lungs and the heart and in every part of the body, every organ of the body, including the brain and including to your fetus and the babies. That is very easy to say, it takes few minutes. Suppose if somebody has come with a total, addiction and then wants to quit, then we need to have little more intense
serious
therapy. Maybe we need in that situation a particular person who is specialized in that. Otherwise, every doctor, every healthcare professional for that matter, can have a say to say that the smoking is not good for people.
What kind of advice would you have to people who want to support their friends and family around who may be smokers or may have tobacco use? मतलब जो आप नहीं इस्तेमाल करते लेकिन आपके घर में कोई है या आपके फैमिली या फ्रेंड सर्कल में कोई है, उसको सपोर्ट करने के लिए आप क्या एडवाइस दे सकते हैं?
See, it's a people movement. The various forces work. We are conditioned, we are conditioned because either there's a peer pressure, somebody says that, this is giving a kick and they go for it and then they get addicted. If all the people in the society, if the public takes it as a challenge, as a movement, that let us bring an end to the smoking and the side effects of the tobacco, and then they can keep talking to each other and tell everybody that it is not good, there is enough scientific evidence, it is not only injurious to every organ in the body but also to our children. So this is something which is very important and all of us can do. Why only the doctor or the institutions or the government should do this? Every one of us has a duty to say that this is something which is a poison. It's a poison. Eventually it's a poison. Tobacco is a poison, smoking is a poison, nicotine is a poison, smoking in any form, alternatives like vaping is also a poison.
How effective do you think are these public awareness campaigns in raising awareness, of course, but also impacting change or changing habits or behaviors?
It's very important because the most of the youth get into this because of the peer pressure, or they see here and there. It could be the social media, it could be the movies, or it could be one of those parties where somebody introduces to that. And it's very important that we catch them young and then go to them and say that this is the knowledge which is available and this is something which we know in the medicine that this is affecting all the organs of the body. And then we also say that in the event of you got into this, there is the mechanisms, there are enough supports for you, support from the individuals, supports from the family, support from the institutions. The institutions also have a big role to play and give that knowledge and the support. If somebody wants to quit in an educational institution like this, we have a tobacco cessation clinic where they can just go in there and then get the help of the doctors and the experts.
Thank you so much for that, insightful advice and suggestions. It was absolutely amazing having you. Thank you so much.
Thank you very much.
And that wraps up the first episode. Thank you to Dr. Srinivas for sharing his invaluable insights on the ills of tobacco use and what we can do to help ourselves and stay smoke-free and healthier. Well, we've just scratched the surface. There is so much more to come. In upcoming episodes, we'll bring more experts, more real-life stories, and practical advice on how you can live healthier, smoke-free, and tobacco-free. Remember, every step towards quitting counts, and we're here to support you on that journey. See you next time.